Take Charge Parenting with the Kids Doctor is brought to you by Children's Health.
Did you know that every day more than 160,000 children skip school due to bullying? It's a growing problem that can be stopped if parents, teachers, and administrators know the warning signs and enforce the rules. Here with some timely advice is Dr. Sue Hubbard, an award-winning pediatrician and medical editor of KidsDoctor.com, and clinical psychologist Dr. Celia Hepner with Children's Health. Good morning, ladies.
Good morning.
Okay, Dr. Sue, let's start with you. It's the first full week of school, and everyone is all excited, but we do understand that bullying may be a part of a child's life at school.
That's right. School's back in session, and kids get anxious going back to school for many reasons. They're excited, new teachers, new friends, but some of them are afraid of being bullied. And bullying is intentional tormenting in a physical, psychological way, different than teasing. And these are the things we need to talk to you about with our own children and the classroom.
Why do kids bully, and why are the numbers rising in this epidemic?
I think many kids bully because they want to feel powerful, and they really aren't powerful. They pick a victim, and then they pick on that victim. I think because we see increasing bullying numbers myself is because we live in a culture of meanness right now. If you see TV shows, things on social media, even in politics, our kids are seeing this all day long. And some families have raised bullies unintentionally because they themselves are bullies.
Okay, Dr. Hepner, how can parents be really proactive in talking to their kids about bullying?
So parents can start to have the conversation early on about what bullying looks like and the difference between bullying and normal social interactions between peers that kids are sort of expected to navigate at school.
Let's talk a little bit about the warning signs. You say there are warning signs.
Sure. So ideally, kids would let parents know anytime bullying is happening, but that doesn't always happen, and for a number of reasons. Parents can look for things like big changes in their child's mood or behavior, things that sort of aren't explained by other factors that are going on, distress around school, avoidance of going to school, symptoms that are normally associated with stress, so things like stomach aches, headaches, especially if these things are getting worse towards the end of a weekend or when school's about to start back after a break. These are all signs of stress in general for kids, so if parents are seeing these things, it doesn't necessarily mean that bullying is certainly happening for their child, but it's sort of a good idea for parents to sort of prompt further and figure out what may be going on that's causing some of those things.
Dr. Hepner, we always talk about building good self-esteem. How do we build a child's self-esteem and their confidence?
So parents can support their child's confidence in social interactions by sort of preparing them to navigate negative social interactions. So sort of walking their child through what they might do if they are bullied, how they would respond to the bully, what they might do next as far as letting a teacher or letting somebody know what's happened. Parents can even sort of rehearse what they might say to a bully in response to something that's come up. And so by kind of giving them the social skills to be able to navigate those situations effectively, kids will be much more confident and comfortable advocating for themselves if something like that does come up.
Okay, Dr. Sue, there are school policies against bullying. How can parents ensure that they're being enforced without feeling like or being a helicopter parent?
It is a fine line, and I think, as Dr. Hepner mentioned, you want to be your child's advocate, but at the same time, I think you start through the appropriate channels. If you have concerns, start with a teacher or the school nurse or someone that your child has a close relationship with, the counselor, and then let the school take it from there. Let them reassure you that the steps will be taken, and then don't escalate it. Let's see what happens before you move on.
Okay, Dr. Sue, real quick, one thing that parents can do when it comes to cyberbullying.
I think that discussion needs to be, once you have a child that has any kind of electronics, I think you need to have that conversation repeatedly. And again, like Dr. Hepner said, do some role playing. Have them write a text and reread it out loud and say, is that hurtful? Would you say that to your friend in person? Right. Because I think we all may be guilty of writing things that we might not say in person.
All right, Dr. Sue, Dr. Hepner, really, really great advice for everyone. Log on to childrens.com/back-to-school for more information about bullying and expert back-to-school advice. You can also follow Children's Health and the Kids Doctor on Twitter and Facebook.
Just like you're always by your child's side, we're Children's Health, and we're by your side. Visit any of our 40 locations for exceptional pediatric care.